Good morning, everyone. Thank you so much for joining us today, October 12th, for the What's New to Medicare 2022 update training. My name is Melissa Devine. I'm the site coordinator for Livingston, Washtenaw, Monroe County. We are going to get started here in a few minutes, but go ahead and grab the handout from the handout section of this GoToWebinar screen. If you're unable to view the handouts, you will get those from your site coordinator here after the presentation. Just some housekeeping rules. We're going to save all questions till the end. However, if you do not want to lose your question, you feel free to type it into the chat or the question box. And we will ask that everybody stays muted during the presentation. And then again, we'll get started here in just a few.
Melissa?
Yes. Are we ready to get started? All right. So we're going to go ahead and get started, everyone. Again, my name is Melissa Devine. I'm the site coordinator for Livingston, Washtenaw, and Monroe County. Today we have with us Bev Clark from St. Clair and Macomb County and Loretta Mack from Oakland County. We are going to go ahead and get started here with Loretta Mack in our 2022 Medicare updates.
Thanks very much. And thank you everyone for attending this morning. We hope that you will get a lot of good information that you can use throughout open enrollment today. Today we plan to highlight those things that have changed in 2022, those things that will change, or items that we want to make you aware of as we prepare for open enrollment. As Melissa has mentioned previously, if you can see the handout section, you can go ahead and grab the handout and download that. If you don't see it, just contact your site coordinator after the meeting and we'll get that information to you. I'm going to cover general information plus the fall timeline. Bev will cover Medicare Advantage and Part D plans, and then Melissa will cover Medigap and counseling tips. So next slide. The Part A and Part B premium information has not been announced yet. We expect that to be announced around the November or December timeframe from Social Security. Most people, as you know, don't pay for Part A if they've worked for 10 years or more, but there is a monthly cost if they haven't worked that long. The Part B monthly premium for 2022 is expected to rise above the current rate of $148.50 for most beneficiaries, but we'll let you know as soon as that information is available, again, from Social Security. Next slide. The 2022 Medicare and U-Books are out, and they highlight 3 particular new services. The COVID-19, it's not new, but there's a whole page of information on vaccines, diagnostic tests, antibody tests, and antibody treatments. This coverage is free currently, but this could change when the public health emergency ends. If you need more information, see page 37 in the Medicare and U-Book. There is also a cognitive assessment and care planning service that's available. This covers a separate visit with the beneficiary's regular doctor or specialist to do a full review of their beneficiary's cognitive function to establish or confirm a diagnosis like dementia and Alzheimer's disease, and to develop a care plan. The beneficiary can bring someone with them, like a spouse, friend, or caregiver, to help provide information and answer questions. The doctor can also help them understand more about community resources like rehab services, adult day health programs, and support programs. The Part B deductible and co-insurances apply for this service. For more information, see page 34 in the Medicare and U-Book. And then there's also a new blood-based biomarker test that Medicare will cover in certain cases once every 3 years. To be eligible, a beneficiary must meet the following conditions. They must be between ages 50 and 85, show no symptoms of colorectal disease, and be at average risk for developing colorectal cancer. The beneficiary will pay nothing for this test as long as their doctor accepts assignment to Medicare. More information can be found on page 36 of Medicare and U. This slide just indicates that beneficiaries should understand the difference between observation status and hospital admission status. Observation status is covered when a person is in the hospital. Their costs will be covered under Medicare Part B. If they are admitted, their costs will be covered under Medicare Part A. So make sure that you verify the admission status or your caregiver or friend who is with you or with the beneficiary when they are being admitted. You should understand which status you're in the hospital under. Next, Medicare Part A, coverage of skilled nursing facility care. It used to be a 3-day prior hospital admission used to be required before a person could get skilled nursing facility care. But during the public health emergency, that 3-day prior hospitalization admission has been waived. Also, for those who have exhausted their skilled nursing facility benefit of 100 days, they can be eligible for an extra 100 days of coverage. They just have to ensure that their doctor prescribes that extra 100 days for them. Next. Michigan has been identified as an area with a high incidence of improper home health care payments. This should not affect the beneficiary as long as they are homebound and they have a prescription for home health care from their physician to indicate that it's medically necessary. For the home health care companies, they'll have to jump through a few hoops. They'll have to at least present more paperwork. But again, for the beneficiary, they should not notice any change. Next, if a beneficiary needs immediate advocacy help, they should contact Levanta. Levanta has taken the place of KEPRO, if you are familiar with KEPRO from the past. If an individual needs to appeal an early discharge or lodge a complaint against a doctor or hospital about their quality of care, they or a family member should call Levanta at the 800 number listed there. The marketplace in Medicare. The marketplace, which individuals can find on healthcare.gov, and Medicare do not coordinate care. So when someone turns 65 or otherwise becomes eligible for Medicare, they should drop their marketplace plan in favor of Medicare. If they don't, they could lose tax credits for their marketplace plan, and they may be penalized if they ever decide to enroll in Medicare down the road. So just be aware of that. Fall timeline, next slide. The timeline is designed to give you an idea of what happens when from September through January. The plans are sending updates, their annual notices of change to their enrollees to let them know of cost and formulary changes as well as non-renewals. The Medicare and U-Book should have been received by now. If someone needs a Medicare and U-Book, you can just let your site coordinator know and we can get that sent to them. Several notices will go out about the low-income subsidy reviews and redeterminations. Social Security will send out the cost of living adjustments. They'll be announced usually in November or early December. Open enrollment period, of course, starts Friday and ends on December 7th, with new plan coverage beginning January 1st of 2022. Next. There are a number of mailings that will go out in the September through October timeframe. Medicare will mail a letter to let someone know if they have lost deemed status, which means they're no longer automatically qualifying for the low income subsidy. It doesn't mean that they can't get it. It just means that they won't get it automatically. They can still apply for extra help. If someone doesn't have drug coverage, Medicare may enroll them in a separate Medicare drug plan so that they'll be able to use the extra help. If Medicare enrolls some in a plan, they'll get a letter letting them know when their coverage begins. And they'll also have a special enrollment period to change plans if they want to enroll in a different plan than the one Medicare has automatically enrolled them in. So Medicare, when they do these auto enrollments, they don't check the drugs that a beneficiary is taking. They just assign them to a random plan. So beneficiaries will be coming to us to find plans that covers their drugs. Next. The enrollment periods are basically not changed. Medicare does not allow continuous open enrollment periods for Part D drug benefits. Most beneficiaries will have a limited time frame to enroll in, disenroll from, or switch Part D plans. The low performing plan, special enrollment period, next. To promote better plan quality and better choice, Medicare will be sending notices to those who are in a Part D plan or a Medicare Advantage plan that fails to get at least a 3-star quality rating for 3 straight years. This notice will let them know about a special enrollment period to enroll in a 4 or 5-star plan. There is currently only one Part D plan with a 2-star quality rating, and that plan is from Clear Spring. And we'll be talking about that later. Next. Are you switching slides, Melissa?
Loretta, can you see my screen? It's on the Medicare Advantage OEP slide.
No.
Okay. Can anybody see my screen?
Well,
or did
I can see part of it. It's huge. Can you reduce the size of it?
Ooh, let me see. Sorry, everybody, for a technical difficulty here. Let me see if I can change the size of the slides. Nope, that didn't do that. Okay. Hang on, I'm gonna back out from that.
Well, I can talk to it just to let you know that the slide is very big.
Yeah. Hold on one second. It was just in the slideshow form. So let's try this one more time. Is it normal size now?
No, but put it back to the Medicare Advantage OEP slide. I'll just talk to it. Oh.
Okay, here, I'm getting there for you. Whoops. There we go.
Okay. This is just to let you know that the Medicare Advantage open enrollment period that began in 2019 is still in effect from January 1st to March 31st. So beneficiaries during this period can switch from one Medicare Advantage plan to another Medicare Advantage plan. They can leave the Medicare Advantage plan to go back to original Medicare. And if they do go back to original Medicare, they can add a Part D plan when switching plans. What beneficiaries can't do during the Medicare open enrollment period is switch from one standalone PDP to another standalone PDP, and they can't join a Medicare Advantage plan if they are in original Medicare on January 1st. You should also remember that a beneficiary can only make one change during this period. Now I'm seeing your desktop.
Okay, so you can't see the slide at all.
Now I can see part of the slide.
Okay.
And I'm going to go ahead. This is on duals and LIS special enrollment period limitations. Dual eligibles and those with extra help can change plans one time per quarter in the first 3 quarters of the year, and then they can make a change during the annual open enrollment period in the fourth quarter. These individuals will have another 3-month special enrollment period following either a gain, a loss, or a change to their Medicaid or LIS status, or notification of a CMS or state-initiated enrollment action. Duals and LIS eligible individuals who are determined at risk, quote unquote, for misuse of frequently abused drugs will not be able to use the duals LIS special enrollment period to change plans once per quarter. There's a new act, the Comprehensive Addiction and Recovery Act, also known as CARA, established drug management programs. These individuals will be notified of their at-risk status under the drug management program. This limitation will last until the at-risk determination expires or is terminated by the plan. This decision is based on opioid use, dosage, and number of providers the beneficiary used. This can be appealed. Next slide. Medicare Plan Finder reminders. We encourage you to use the personalized search, which requires a beneficiary to have a Medicare.gov account so they can use the list of current drugs, which will pop up. They can edit that list, delete, or add new drugs to the list, and the LIS eligibility level for that individual will also be listed. You can save the username and a password hint in Ship Tools, but do not save the actual password. There is some data in the Plan Finder that has moved, data such as what tier a drug is on and whether it will be subject to prior authorization, a quantity limit, or a step therapy. That information is now at the very bottom of the detail page, and you'll need to click on the plus sign next to the words View More Drug Coverage to see it. You can also choose to see 2021 plans for someone who is new to Medicare this year, or for most people, look at 2022 plans. Next, frequently asked questions. If I enrolled a person in a PDP or a Medicare Advantage plan, can they change their mind? Can anything be done? Yes. You can enroll them in another plan, however long it takes, however many plans it takes. The last enrollment will be the enrollment that takes effect. Second question, can I enroll a person in a Medicare Advantage only plan with no drugs and a PDP? The answer is no. HMOs and PPOs, you must use the drug coverage that comes through that plan. If we had private fee-for-service plans, which we don't, someone could enroll in a private fee-for-service plan without drug coverage and also enroll in a PDP. But again, that does not apply to us. So beneficiaries can change their minds and enroll in a new plan more than once between October 15th and December 7th. This is just to remind you that if someone disenrolls from primarily a Medicare Advantage plan with a separate dental, vision, or hearing rider, they must cancel the rider separately. So the rider will still be in effect if they don't cancel it. So they should contact the plan in order to cancel the plan coverage as well as the rider. The new extra benefits will be listed in the Plan Finder, such as fitness benefits, transportation, telehealth, and more. Next, if you run into a Plan Finder problem, you should rule out any issues with your computer, your network, or your browser. Ensure your browser's up to date. And if you run into a problem that you can't solve, report it to 1-800-Medicare. See if they can recreate the problem and ask them to report it to their IT team. You should also contact your site coordinator so that we can submit a trouble report to Medicare. That is all that I have. I'm going to turn it over to Beth.
Thanks, Loretta. You're actually turning it over to me, Melissa.
Oh, I'm sorry.
That's okay. No worries. All right. Thank you, Loretta, for giving us that information. We are going to jump right into your favorite part, the 2022 Part D standard benefit structure, information on our prescription drug plans and Medicare Advantage plans. So this is our 2022 standard drug benefit. You can see that we've got the deductible for 2022 for Part D plan is $480. Remember, not all Part D plans do have a deductible, but for those that do, the maximum deductible amount is $480. Somebody will enter into the, or I'm sorry, exit the initial coverage limit or the initial coverage phase once they've paid $4,430, with the true out-of-pocket threshold at $7,050 to exit the catastrophic coverage phase. Once they're into, I'm sorry, the coverage gap. Once they're in the catastrophic coverage phase and have exited the coverage gap or the donut hole, they will have a minimum cost sharing. It's going to be 5% or $3.95 for generic and $9.85 for a brand, whichever is highest. And then, of course, you know, we've got our national base premium at $33.37. That's how we're going to calculate the Part D penalty. And in terms of extra help, if somebody has full extra help, they're going to pay $3.95 for a generic or $9.85 for a brand. If they are full dual with Medicaid and LIS, they're looking at $1.35 for a generic, $4 for a brand. And if they have partial extra help, they have a deductible of $99 and a 15% copay. The benchmark premium for LIS this year is $31.49. So if they're able to find a plan that is participating with LIS and is $31.49 or less, they will generally have that premium paid in full. So this is that basic benefit structure in terms of phases. So with the deductible period, a beneficiary, if they have a Part D plan with a deductible, they will pay the full negotiated cost for their drugs up to $480. Remember, there are some medications that the deductible will not apply to, some Tier 1 drugs. But once they've paid that $480, they will then enter into the initial coverage phase, and they're going to pay their set copays and coinsurances for their drugs. They're going to also, during that initial coverage, they're going to pay their negotiated copays or coinsurances for their drugs until they've paid the $4,430 in total drug cost. Total drug cost does include the amount that they and their plan have paid for their covered drugs. Once they've paid the $4,430 in total drug costs, they're going to enter the coverage gap, or what used to be the donut hole. This is where they're going to pay 25% of the cost of their drugs until they've paid the full $7,050 true out of pocket, or they have billed the insurance $10,690 in retail costs. Once that true out of pocket or that billing for the insurance in the retail cost has been met, they will then enter into the catastrophic phase. This is where they are responsible for 5% or $395 or $985, depending on which is greater. So the Part D coverage gap used to be referred to as the donut hole. As we've mentioned many years, that was closed. So there is no difference whether it's a generic or a brand name medication. They are responsible for 25% of the cost when they're in the coverage gap. Because LIS beneficiaries do not have the gap in coverage, you will likely not see a change in the benefit structure for them on the Plan Finder. Beneficiaries will continue to pay their LIS co-payments throughout the year until they reach the catastrophic level. Part D late enrollment penalty. So if a beneficiary does not have creditable coverage, they do not enroll in Part D, they will pay a late enrollment penalty. It is going to be added onto their monthly premium, and it will continue for the entire time that they have Part D. We calculate that by taking 1% of the Part D base beneficiary premium, which again is $33.37, so $33.37 in 2022, times each month that they did not have the creditable coverage and did not enroll in Part D. Because this amount does change each year as the Part D base beneficiary premium changes, we can kind of give them an idea, but we really can't give them the exact number. That is something that's going to come from Medicare and Social Security. So just a quick note though, the late enrollment penalty did start back in 2006, June to be exact. So if you encounter somebody who never had Part D prior to 2006, you need to start your calculations for June 2006 and then going forward. All right, Part D income-related monthly adjusted amounts, or IRMA. Part D premiums are subject to the income adjustment. So any beneficiaries with significant income are going to pay a sliding scale higher Part D premium based on their IRS tax returns from 2 years prior. There are 6 income categories, and each category has a set dollar amount associated with it. So it's going to be based off of whether somebody is a single individual tax filer or if they are a joint tax filer. If their income is under $88,000 for an income tax filer or under $176,000 for a joint tax filer, there is no added IRMA to their Part D premiums. But if they're above those limits, as you can see, it will increase. So for somebody with more than $88,000 single or $176,000 for a joint, they're looking at an extra $12.30 plus their plan premium. And it will continue to go up. Now this is for 2021 because we don't currently have 2022's IRMA numbers. We will receive that around the time that we receive the Medicare Part A and Part B premiums and the COLA increase information. But if somebody asks you, what that information is right now, maybe they're new to Medicare, you do have access to that information here. And if for any reason they're concerned that their threshold level is higher than what they make now, they are certainly able to appeal that through Social Security with a change in life circumstance form. You can get that online through Social Security's website or ask your site coordinator for further assistance with that. All right, 2022 LIS and Extra Help. So again, this is based off the income thresholds of the federal poverty level. Any new thresholds are going to be released in January. But if somebody is eligible now, they'll be eligible for all of 2022 as well. And when I say now, I mean if they received that redetermination letter that shows that they're still eligible for the remainder of this year, they will be eligible for the following year as well. Again, that benchmark premium is $31.49. So if they are able to get into a plan that is $31.49 and less and they participate with the LIS program, their premium will be covered. Now let's meet our plans. We're going to take a look at our Part D and Medicare Advantage Part D highlights. So our plan statistics, this year we actually have a decrease in the number of plans available for Part D. We went from 29 to 23. We have a total of 14 enhanced plans and 9 basic plans. Of those 23, we have 4 of them with a $0 deductible. And the lowest premium with a $0 deductible would be Silver Script Plus, and it is running $64.10 for 2022. We have a total of 5 Part D plans that are under a $25 monthly premium. And the lowest Part D premium is still Silver Script SmartRx. This year it did go up 60 cents though, so it will be $7.50 instead of $6.90. The highest Part D premium, again, is still Prescription Blue Premium, and this year they went up $4.40 and now will be $113.70. There are 2 Part D plans with gap coverage. And the lowest cost plan with gap coverage is Cigna Extra RX at $61.50 per month. The national Part D providers are Aetna, Cigna, Elixir, Humana, United Healthcare, and WellCare. So those are going to be the plans that are nationwide for Part D. We do have some Medicare Advantage plans with Part B premium reductions. We did a little proactive work this year to make sure we could gather that list because people do often want to know whether they can jump into a plan that's going to offer them a reimbursement to their Part B premium. So you can see we have about 9 plans here with their contract ID, all with varying give back amounts. The AARP Medicare Advantage Patriot PPO Medicare Advantage plan is offering up to $40 each month. And the other plans are offering a set base amount. So Aetna Medicare Eagle is a $35 give back amount. The Ascension Complete Michigan Reward HMO is a $100 give back amount, and more. Most of these plans, if they offer drug coverage, are great for anybody, but there are some that are just medical. So if it is just a medical plan only, that would be great for like a veteran or somebody that has other drug coverage. When they say that it's a give back amount, that means that they are going to, the plan themselves, give that money to Social Security, and then the individual will see a decrease in the amount that comes out of their Social Security check for their Part B premiums. These are our Part D LIS plans that will represent a $0 premium for beneficiaries. They are below the $31.49, so that's why there'll be a 0 premium for them. But we do have AARP Medicare Saver Plus, ClearSpring Health Value RX, Elixir RX Secure, Humana Basic RX, Cigna Secure RX, SilverScript Choice, and WellCare Classic. Just a side note really quick on the ClearSpring Health Value. Because ClearSpring Health Value is a 2-star rated plan, if somebody is interested in enrolling in this plan, they cannot do so through the Medicare Plan Finder's website. They will need to make sure that they reach out to the plan or call 1-800-MEDICARE to do that enrollment. For special needs plans, there are plans that are available for those with just chronic illness, those that are institutionalized, and of course those that are dual eligible. For those that are dual eligible, we do have 12 plan options in Macomb, 10 plan options in Washtenaw, 9 plan options in Livingston and Oakland, and 8 plans in Monroe, and 6 plans available for St. Clair. Our Medicare Plan Finder uses a star rating system to measure how well Medicare Advantage and Part D plans are performing. Medicare scores show how well a plan performs in several categories, including quality of care and customer service. These ratings range from 1 to 5 stars, with 5 being the highest and 1 being the lowest. Plans are rated in each individual category, and Medicare will assign plans with overall star ratings to summarize the plan's performance as a whole. A beneficiary can use the overall star rating to compare performance among several different plans. Medicare reviews plan performance yearly and release the new star ratings each fall. So that means the plan ratings may change from year to year. So before considering just a plan star rating, make sure that the plan's coverage and cost suit the beneficiary needs. If they're considering a Part D plan, be sure that the plan will cover their drugs at a cost that will work for them. But in an effort to promote better plan quality and better choice, Medicare is sending notices to those who are in a Part D drug plan or a Medicare Advantage health plan that fails to get a 3-star quality rating for 3 straight years. This notice lets them know about a special enrollment period to enroll in a 4 or a 5-star plan. And as that information, becomes handy for everybody, we will let you know. We do have several 5-star plans though for Medicare Advantage this year, which we are very excited about. There are 9 total. They are AARP Medicare Advantage plans and BCN Advantage plans, all of which are listed here with their plan name and their contract ID. So if that is something that you encounter in counseling, you can refer back to this slide with that information. So again, low performing plans in Medicare's website, plans that are receiving less than 3-star quality rating for 3 consecutive years are considered low performing plans. Beneficiaries will not be able to enroll on Medicare's website with those plans. They can enroll directly through the plan by calling 1-800-MEDICARE or calling the plan itself. A warning will appear on Medicare's website for those plans that are low performing. For 2022, we have 2 Part D plans with a 2-star rating. That would be ClearSpring Health Value RX and ClearSpring Health Premier RX. Again, the names and the plan ID numbers are listed here on the slide for you if you have somebody who needs more info on that. All right, marketing guidelines for Medicare Advantage and Part D plans. They cannot market themselves as a Medicare endorsed plan. They cannot discriminate based on race, ethnicity, national origin, religion, gender, age, mental or physical disability, health status, receipt of health care, claims experience, medical history, and more. They're not allowed to target higher income areas. They can't say that they are plans that are only available to seniors rather than to all Medicare beneficiaries. And they can't use the term free to describe a $0 premium, a reduction in premiums because of the Part B buy-in, or a reduction in deductibles or cost sharing. They can't use the term free to describe the fact that they participate with LIS and maybe end up with a $0 premium because of the LIS benchmark. And they must include the plan type at the end of each plan name on all communication materials, including their marketing material. They can set up marketing appointments. They can distribute business cards and contact information for beneficiaries to initiate the contact. They are prohibited from conducting back-to-back educational and marketing sales events. So if they were to be out and about, maybe into any of those low-income facilities, for folks, they can't have a sales presentation and do enrollments in the same day. They would have to connect back with the beneficiary later to do so. So if you encounter anybody who's had any of those issues, let's get them reported. Let's connect with your site coordinator and report that so that they can't market incorrectly and do fraudulent things. All right, so that's it for me. I'm going to pass it off here to Bev Clark, our St. Clair and Macomb site coordinator, to discuss Medigap.
Good morning, everybody. I get to handle Medigap as a topic today, the review of basics and some general updates. Now, we're going to talk about Medigap today because it's something we never talk about, because every individual has their own enrollment period for Medigap. So we'll go over some basics here that you might know or you might be able to use as a refresher. Medigap plans are different than Medicare Advantage plans. Advantage plans take the place of Medicare Parts A and B. They offer a different way to get that coverage, whereas a Medigap plan supplements A and B. It fills the gaps or the out-of-pocket costs that are incurred with original Medicare coverage. Just like Advantage plans, a person insured by Medigap must also pay their Part B premium, and no currently offered Medigap plans cover the Part B deductible. Medigap plans sold by insurance companies must be one of the standardized plans approved by Medicare, indicated by the letters A, B, D, G, K, L, M, and N. Each plan has a different set of benefits and is the same no matter which company offers it. Premium rating methods. There are 3 methods that we hear referred to all the time. Community rated. This means that generally the same monthly premium is charged to everyone who has that Medigap policy. Premiums may go up because of inflation or other factors, but not because of the beneficiary's age. An issue age rated policy. The premium is based on the age of the beneficiary when the policy is issued. Premiums are lower for persons who buy the policy at a younger age, and premiums may go up again because of inflation or other factors, but not because of a beneficiary's aging. The third and most common is age attained rated. This premium is based on the current age of the beneficiary when they are in the plan. The premium goes up as the beneficiary ages. And while this type of plan may be the least expensive to initially purchase, it can eventually become the most expensive because the longer the beneficiary lives, the higher the premium goes. So there are enrollment periods for Medigap. The primary open enrollment period is the first 6 months that a person has Medicare B and age 65 or over. This is their guaranteed issue open enrollment plan. They are able to purchase a Medigap plan, any Medigap plan that is offered in the area in which they live. The insurance companies have to sell it to them during that first 6 months, and they cannot be subject to medical underwriting, which is looking at health pre-existing conditions. Now, there are a variety of other situations in which a person gets a guaranteed issue, is guaranteed the right to be sold that Medigap policy without medical underwriting. These situations most commonly include when a person loses other health insurance coverage in some way, or specifically when a person purchases a Medicare Advantage plan but wants to try a Medigap plan. Now, there's a comprehensive list of these instances on Medicare.gov, and I encourage you to go to Medicare.gov, use the search term Medigap Guaranteed Issue, and that gives you a list of each situation in which a person has a guaranteed issue or a trial right for Medigap plans. And of course, you know that anyone can purchase a Medigap policy at any time after turning 65 and enrolling in Medicare. But then the company selling the policy has the right to do that medical underwriting, checking pre-existing conditions. They can charge a higher premium, as high as they choose to place the premium, and the company can refuse to sell that beneficiary a Medigap plan altogether. An important Medigap note is that not all Medigap plans sell to people who are under age 65 and qualify for Medicare due to a disability. However, if a person is on Medicare under age 65 due to a disability and then turns 65, he or she has that Medigap open enrollment period, the guaranteed right to be sold a policy without medical underwriting for that first 6 months because they've turned 65 and they're already enrolled in Part B. Medigap plan options. So effective in 2020, beneficiaries new who've aged into Medicare cannot purchase Medigap plans C or F. You have heard this before. Insurers will no longer sell C and F, but they can keep current enrollees in plans C and F. If you're counseling someone, plans D and G are the closest alternatives to C and F. So insurers can keep their current enrollees in C and F. They can't sell new plans to beneficiaries who turned 65 on or after January 1st, 2020. If someone is 65 and older before January 1st, 2020, they can apply to purchase a Medigap plan if they've had Part A before January 1, 2020, and they get Part B on or after January 1, 2020. Because remember, the Medigap open enrollment period occurs when someone is 65 and has enrolled in Part B. Now, a reminder on why this change was made. Congress wanted to level the playing field between all the Medigap plans, all the standardized benefits. No plan now pays the Part B deductible. So, info on Medigap plans in the 2022 Medicare New Book starts on page 75. Okay, you can find this chart, which details the standard benefits of each Medigap plan in the 2022 Medicare New Book on page 76. The Michigan Medigap Subsidy. The first thing that you need to know about this is no new enrollments are being taken into the subsidy as of January of this year. The program ends when the funds are gone, and it's currently being phased out. Those who have the subsidy will lose that subsidy in 2023 or possibly at the end of 2022. So current people who currently have the subsidy, their premiums are reduced for Medigap by $25 if they're age 65 to 75, $45 a month, or $75 a month. Now, the companies that have participated in the subsidy are AARP United Healthcare, Blue Cross Blue Shield of Michigan, Blue Care Network, McLaren Health, and Priority Health. So if you counsel someone that has one of those plans and they talk about the Medigap subsidy, they do not need to re-enroll. They will continue to have the subsidy next year, but you need to let them know that it's being phased out and will disappear by 2023. Medigap Plans extra benefits. Here's the something new about Medigap Plans this year. Actually, it started last year, possibly 2 years ago, and they've been phasing them in little by little. But Medigap Plans are now, it looks like they're trying to compete with Medicare Advantage plans because they're offering some extra benefits like dental, vision, hearing, and gym memberships. Some of them offer a little stipend for over-the-counter drugs and some of the other things that look like Medicare Advantage additional benefits. So these programs are available to purchase along with the Medigap policy, or they're offered as a discount program with a Medigap plan. We did some research, and these are the companies as of now that are offering extra benefits of one level or another when you purchase a Medigap plan. AARP United Healthcare, Blue Cross Blue Shield, HAP Humana, Perkin Life Insurance Company, Priority Health, and Wisconsin Physicians Service Insurance Corporation. Now, each one of those plans may offer something different in terms of these extra benefits, so additional research needs to be done by the beneficiary. So how do people shop for a Medicare plan? These are the things that people need to consider. Are they in their open enrollment period, that first 6 months after they've turned 65 and they've now enrolled in Part B? Do they have a guaranteed issue? Or do they need to think about the fact that they might be subject to medical underwriting? They need to consider their health status and their age when shopping for a Medigap plan. They need to consider the type of Medigap plan amongst those standardized benefits, that alphabet soup of plans that are available, the cost of each plan, customer service ratings, and these extra benefits that some of these plans are now offering. So we have resources where we can help people compare these Medigap plans. We have resources that we haven't had before, but for the last year or maybe 2 years, there has been a Medigap Plan Finder in ShipTools. It's a great tool. If you haven't looked at it, go to the ShipTools library and click through the link there and check it out. This is the only way you can get to the tool, is through the library. It's something that all of the SHIP programs have an availability for, but if you try to get into it as a private citizen, it's a paid service that you have to subscribe to. It really is valuable. It shows the different kinds of plans that each company offers, and it doesn't show those extra benefits, but most importantly, it gives you contact information for each of the Medigap plans that are available within a person's area. And you can do a personalized search there just by having somebody's zip code and their age and whether or not they're a smoker, and find out everything they might want to know about any Medigap plan. There is a plan finder for Medigap in Medicare.gov, but it's not as robust as this plan that you can get to through the ShipTools library. So we recommend shopping through the ShipTools library, helping beneficiaries shop that way. Michigan Department of Insurance and Financial Services, DIFS, has information on Medigap plans, and the Michigan Association of Health Plans, the link for which is here. But you have to keep in mind that while we can provide information to beneficiaries on Medigap plans, we cannot enroll a beneficiary in a Medigap plan like we can for Medicare Advantage or Part D. Beneficiaries need to contact the plan that sells the Medigap insurance and enroll themselves in the plan. This is something they can do after they've already called the plan once and found out the details of the particular plans and extra benefits that they offer, but ultimately it's the beneficiary's responsibility to enroll. So we have a couple of counseling tidbits that we want to share. The first one is reminding you about calculating savings. It is incredibly important to record the cost share savings for benefits when you're doing enrollments. We used to be able to, quote unquote, poke the bird when we did an enrollment for someone, and that would send the information nationally for the work that we were doing. Now, when we have cost savings for beneficiaries, the only way that our funders know the work that we're doing is if we record this accurately in our ShipTools client contacts. So this is a chart that shows the locations in the client contact, which you will need to check, which correlate with recording the savings, and you do need to upload those documents. Now, we went through this in detail in the September update training that we offered. This is also the same process that we did last year and offered training on. But if you want a refresher on it, don't hesitate to contact your site coordinator, and we will be happy to go through and give you another refresher on calculating the savings and how to upload the documents. So here are your 4 takeaways in the counseling tips section of this presentation. Number 1, make sure you report all of your counseling in ShipTools. Every contact that you made, whether you talked to someone for 15 minutes or you talked to someone 3 times for an hour and a half each time, recorded in ShipTools. And when you do plan comparisons, include the cost share savings and upload the documents. Number 2, incorporate fraud education into counseling with every single client. Even if you just discuss protecting their Medicare card, or you tell them why they should shred all that junk mail that they get from health insurance companies so that someone doesn't steal a piece of mail and fraudulently enroll them in a plan and then they get your Medicare number. Any conversation like that counts as fraud education. And you need to make sure that you mark the correct boxes in your client contact report when you report this fraud education. It's under SMP, Healthcare Fraud, Errors, and Abuse, and that title shows up in 2 different places, one in Section 6 and one in Section 7. So you need to check a box in each of those sections and briefly describe your fraud education conversation in the notes. And number 4, your site coordinator will send you the phone contact or Zoom license login information and your schedule for each of your open enrollment appointments. You will receive this info no later than the day before your day full of appointments. And if you have Monday appointments, you'll receive the details the Friday before. So I skipped 3 because I wanted to emphasize that was the most important. If you haven't already, sign up to help at a Medicare open enrollment counseling. We've got counseling going on almost every day from October 15th to December 7th. If you haven't signed up yet, or you think you may have some additional spare time, please contact your site coordinator with the dates that you're available to help.
All right. Well, thank you, Bev, for that information. We are to our questions part of the presentation. I am going to stop recording the presentation, so then that way, if you guys have questions you want to ask and not be recorded, you can do so.